With 2 more deaths recorded in connection with COVID-19, the medical chief officer is warning of the increased risk for exposure to the virus. Speaking at a recent press conference, Chief Medical Officer Dr. Hazel Laws said a few weeks ago the contact tracing process was showing the existence of clusters of COVID-19 infections. This circumstance has changed, however, she said, and most infected persons are now not able to make possible connections with others.
When we look at the data now coming out of the contact tracing process, individuals or positive cases are now unable to tell you, who they were in contact with, who were positive. And so the virus is spreading at a significant level. And so our risk of exposure to the virus when in the public space is increasing. And so we need to be very mindful in terms of our adherence to the COVID-19 preventive and protective measures. And most importantly, those of us who are unvaccinated, we are reaching out to you. Empower yourself with the facts about the vaccines. We now have 2 options. Come on board and protect yourself. So in other words, you can leave your house, go to the supermarket, go to the pharmacy, or go to the wherever, and your risk of exposure to the virus is now higher than it was a few weeks ago. And so you need to protect yourself. In terms of vaccination, that's the best tool we have in our bag at this time. Wearing your face mask at all times, hand sanitization, and distancing yourself from others.
As cases of COVID-19 top 1,900 infections in St. Kitts and Nevis, health authorities are finalizing the positioning of a field hospital donated by the U.S. government via one of its humanitarian agencies.
The field hospital that we are supposed to be getting, it's a 40-bed hospital, and I want you to know, when we say that we are getting a field hospital, it doesn't necessarily mean that this comes with a CT scan and an X-ray machine, etc. And so the best place to have a field hospital is close to the hospital where you have the ancillary services. And so we have been looking at a space between medical ward and private ward. There's a big open space there where we will be in discussions with persons from NEMA and other stakeholders to determine whether or not that would be the best place to put the field hospital. So if someone needs a CT scan, X-ray, etc., they will not have to travel from an off-site to the hospital to get that.
As of 28 September, there were 915 active cases in the Federation, of which there were 333 active cases on Nevis, with 13 COVID-19 related deaths recorded in the Federation. Glenn Bart reporting for SK Newsline.